welcome to Vitals of Academia with New York Medical College's BINGAP chapter. I am Angeli, co-president for BINGAP Seaboard. Building the next generation of academic physicians is a national organization that aims to help underrepresented groups become aware of academic medicine careers as a career option and to provide them with the resources to further explore and potentially embark on an academic medicine career. New York Medical College's chapter of BINGAP started in 2022, and it aims to increase diversity in academic medicine and provide students with the tools needed to begin their careers. Vitals of Academia is a new podcast that aims to highlight the careers of academic medicine physicians and demystify the process for how they build their careers. I have with me today the wonderful Dr. Pamela Ludmer. And as I read her bio, after 10 years in clinical practice as an internal medicine and pediatric specialist, Pamela Ludmer returned to academic medicine, where she gradually took on more leadership roles, most recently as Dean for Undergraduate Medical Education. After the tragic deaths of George Floyd and Breonna Taylor, Dr. Ludmer proposed the creation of the Anti-Racism, Anti-Bias, and Health Inequities Committee at the School of Medicine, which she subsequently chaired. Outcomes of this work have included a complete review of the MD program curriculum with implementation of new programs on structural competency, the development of educational milestones for DEI, and expanded attention to LGBTQ health and disabilities. Dr. Ludmer also helped create a grant-funded transformational education leadership program, which helps to combat systemic racism and implicit bias through medical education. Furthermore, Dr. Ludmer engaged in multiple faculty, administrative, and student stakeholders to implement a fully redesigned and integrated curriculum, which launched in 2022. Dr. Ludmer is also a certified leadership coach with a focus on physician women in leadership. She is one of the co-creators and program director for the American Medical Women's Association Elevate Leadership Certification Program for physician women. So welcome, Dr. Ludmer. We are so happy to have you on this podcast today.
Thank you so much for having me. I'm looking forward to our conversation.
Yes, me as well. So I guess to start off, our first question is, can you tell us about your journey to becoming a physician and what inspired you to pursue medicine?
Yeah, so I always wanted to be a doctor from the time I was a child. My father is a psychiatrist from Argentina. And when he would come home from work, I would just sit at the table with him and ask him questions about the patients he saw that day, what they brought to him, how he helped them. And from there, I really got very interested in psychiatry. When I was in college, I majored in psychology, still planning to be a psychiatrist, and then got to medical school. Still thought I was going to be a psychiatrist, but we know the first 2 years are all in classrooms pretty much. And once I got into the clinical realm and started doing my rotations, I really found out that I loved medicine and I loved pediatrics much more so than psychiatry. So that's how I ended up doing this combined residency program in internal medicine and pediatrics. And then from there, I developed a love of adolescent medicine and pursued a fellowship in adolescent medicine because that's just such a tricky time. We all remember our teenage years and they were challenging. You know, there's medical issues, there's psychological issues, there's social issues. So that's really the patient population that I ended up really loving working with.
Right, awesome. Yeah, I think it's like the perfect example of like going into medical school with an open mind and seeing what changes, because you went in like definitely wanting to do psych and then switch to kind of doing like internal medicine and peds, which I think is something a lot of students don't even know that you could do, is like dual apply in both residencies. I didn't realize that till my 4th year that was even like an option for people to do. So
Yep. I think that's a great approach to medical school. It's great if you have an idea of what you want to do, but exactly as you said, be open to all the experiences that are available to you as a medical student and take advantage of all of them.
Awesome. Yeah, definitely things to keep in mind for the younger years, for all the first and second year students. And then what were the early years of your medicine career like, and how do you transition into academic medicine?
Yeah, so my early career was, as I mentioned, totally focused on adolescent medicine. So I started off working at the Adolescent Health Center in New York City, associated with Mount Sinai. From there, I went to College Health, and I was working at a local college in the College Health. And I realized I was really missing the teaching and I was missing medical students. So after about 10 years, I knew the then dean here at New York Medical College and started doing some volunteer teaching. And I did that for a year or so where I volunteered, and then I decided I wanted to do more teaching and gradually started getting more and more involved in the school. And a time came where I decided I wanted to have an even bigger impact on the curriculum. I didn't, teaching is wonderful, but I wanted to have a broader impact on the curriculum and on the educational program. And I started to have my eye on becoming a dean. So I had this idea that I wanted to become a dean and started to think, what is my path to get there? What will I need to do if I want to be a dean? So I ended up getting a master's in medical education leadership. And that was hugely instrumental, and still is. It still really influences what I do every day, how I plan my work, how I interact with people. So that really opened the door for me. And I became an associate dean for curriculum integration and now dean of undergraduate medical education. So that was a really important part of my trajectory, is recognizing what I wanted to do and then creating a plan for how I was going to get.
Yeah, awesome. Yeah, I think yeah, they kind of like if you don't plan to succeed, you'll end up like planning to fail. And I think that's kind of the perfect example of like knowing what you want and kind of working your way to there. So
Mhm.
yeah, awesome. And do you think that kind of having that background in like working adolescent medicine and like working private practice in the beginning helped you to transition, or do you think it was like hard for you to make that transition over to education?
It wasn't hard to make that transition because I wanted to do it. I think that's probably one of the most important things, is that I knew I wanted to do more and more. And my clinical background, I think of internal medicine and pediatrics, and then adolescent medicine also actually gives me a really unique lens to work with medical students. Because I also worked in college health. So I also understand what it's like to be in a setting in a very intense educational program, trying to be a student at the same time. So I actually think all of those things have really helped me in terms of preparing me for my role as dean. But then also, even from the curriculum perspective, since I have a background in pediatrics, so I understand pediatrics, medicine, I understand medicine, and the adolescent medicine really gave me an interesting background in psychiatry and in gynecology. So all of that has really been incredibly instrumental and helpful and positive in terms of where I am today.
Yeah. Awesome. Yeah. Yeah, I guess that's true. You kind of like probably see everything from like all the different lenses, and you probably know like best like what every individual group goes through because you've been trained in all of that. So that's like the perfect foundation for being a dean of a medical school.
Yeah, I have the gap of surgery. I will acknowledge I have that gap, but then I find other people who have the expertise and I know when to lean on them, which I think is such an important quality for a leader to have. I think people think that when they're in leadership, they have to know everything and they have to be good at everything, but that's not true. Part of the important role of being a leader is to recognize what your gaps are. We talk about this with students all the time, but even as a leader, recognize the gaps and seeing who can I engage in the process, who can fill that gap and can help me do my job better.
Yeah, yeah, that's very true. Yeah, being able to identify the gaps so you can like meet them is key.
Mhm.
And I guess kind of along those lines, do you feel like were there any specific mentors or people along the way that kind of helped you to not only identify those gaps, but know how to address them and kind of get to those next steps?
Yeah, really interesting. I had a couple of mentors, and I still have a few mentors here who I go to when I'm not sure what to do or I'm having challenges or struggles. But the key for me was actually the coaching. And that's what led me to want to become a coach. Was I realized that I had a lot of book knowledge about how to be a leader. I knew what to do, but that didn't necessarily mean I could do it in practice. There was always something more that I wanted, and I wanted a little bit more help to say, okay, well, what's the right answer for me? What should I do in this situation, given my current situation? I didn't necessarily want to know from somebody else, well, this is how I handled it, and that worked for me, because I wasn't that person. That person wasn't in my situation. So for me, it was actually the coaching that was really instrumental, because then I could go and really have the time and space to say, okay, so what is it that I want to do? What's the outcome that I want? What can I do to perhaps do this differently or do this better? Where do I need to go for help? So the coaching was really instrumental, which is also something we talk about with medical students in terms of their career and their professional development, is to get coaching to help them with that. And that's something that still today is very valuable to me, and something that I still seek coaching, because even once you get to a certain level, it doesn't mean you stop needing help, right? We always need help. And so that's still something that I look for today.
Yeah, that's definitely very true. Whenever I hear like leaders or experts in there, they'll talk about like their mentors, their coaches. I'm always just like, yeah, it kind of shows that you never should end, because there's always probably someone in a different uh field, a different specialty, different like set that you haven't gotten to yet that you still need to kind of grow from and learn with. So
Mhm.
and then I guess, can you talk a little bit more about like the coaching, like how you found your coach and kind of like what that process is and how to even find a coach? I think we always talk about mentorship, but I think
Yeah.
coaching is something that we don't really talk about, especially in medical school and, as students. So,
Yeah. Yeah. Well, for me, my first coach was because what I really wanted was a women's leadership coach, because I felt that some of the struggles was having initially had to do with being a woman in a leadership position, particularly when I would be in a space with older white men, that I found that difficult and didn't always know how to manage those situations. So when I first found my first coach, it wasn't around the field of medicine, it was just a women's leadership coach. And she was really helpful. But then I decided, okay, I want to do this for other women coming after me, because I have this mission of helping female physicians who are interested in leadership stay in leadership and develop leadership skills, which is why I'm involved in the American Medical Women's Association. But as I got more involved in coaching, and coaching is becoming even bigger, there are places where we can look online and people can look online for a coach. So there are specific physician coaching organizations that people can go to. I would absolutely say the American Medical Women's Association has coaching for residents, it has coaching for physicians. They're working on coaching for medical students. It's a little trickier, but they are working on that. There's an organization called Physician Coaches Alliance. So they have a website and they have a whole list of physician coaches with a lot of different in a lot of different kind of niche areas of expertise. So I think if anybody listening is interested in finding a coach, I'd be happy to provide resources and help people find, get some direction in terms of where to look for coaches. And actually nowadays, some professional societies and professional organizations provide coaching. So in surgery, there may be some specific surgery-based coaches, pediatrics, some specific pediatric coaches. So it really is becoming growing, and I think easier for people to find coaches nowadays.
yeah. Yeah, definitely. So, yeah, so if you're interested in getting a coach, definitely you could use those resources after Lemmer said, or reach out and she could provide additional resources.
Mm,
And then I guess kind of on that vein, in case someone was like wondering, what's the difference between me finding a mentor and me finding a coach? Can you kind of say like, what you kind of you would use both for? I think you touched
yeah.
on it a little bit, but just for people who might be confused, like I already have a mentor, why do I need a coach? Like what would you
Yeah.
kind of say to them?
Yeah, so a mentor is great for saying, this is what I did, this is how I got to where I am, this is what I think you should do, these are the steps, A, B, C, D, and E. And if they're really highly effective, and let's say they're also a sponsor, they might say, oh, and let me connect you with this person. You need to meet person B because they're 10 steps ahead of you and they can help you get into your next position. That's the role of a mentor. A mentor doesn't necessarily get coaching how to be a good mentor. A coach, and especially a certified coach, has training on what it means to be a coach. The idea behind coaching is not that the coach has the answer. That's the role of the mentor. The coach helps the client who's coming in, or the student or the coachee, to find their own solution, to find their own best answer, to help them become better problem solvers, to help them come up with their own solutions that work for them. So I might say, for example, Angelique, if you came to see me with a problem, I might say, well, what do you think is the best thing to do? And you might come up with an answer. And then I might say, what do you think will happen if you do that? How do you think the other person will react? What is most important to you about that? What is the outcome that you want to have? So it's a lot of questioning to help the other person really think and come up with with their own answers. So at the end of the day, it's really a way of personal and professional development and empowerment, so that the other person eventually really doesn't need the coach anymore, perhaps, because now they're able to figure things out for themselves.
Yeah, awesome. Yeah, and I like the way you kind of ended it. You know, with a coach, you might not need it anymore versus a mentor, you might need throughout your whole career in different stages, if you have the same one, because they're serving different roles. So that was like a
Yeah.
great kind of way of like breaking them down and explaining it. Thank you.
Yeah, and you may need a different type of coach depending where you are in your career, right? But the idea behind coaching is to try to help somebody start to figure things out on their own.
Yeah. Yeah, kind of get you to learn the problem solving on your own and like strategizing on your own so that way you kind of get to a level where you're more self-sufficient in a sense.
Mhm,
So
mhm, mhm, mhm.
thank
Although
you.
I will say I still sometimes need a coach. Like, so sometimes I still need somebody to be that sounding board to even just, help me think through, like, am I thinking about this the right way? And they won't say, yes, you're thinking about it the right way, but they'll say, well, what do you think? Do you think you're thinking about this the right way?
Yeah.
Reflect all those things back to me. So,
Yeah. And the reflection is key. The reflection is important because if you're not able to kind of reflect, not only in your career, but it's like in your life in general, kind of helps you to know what next steps you need to take and how to take them.
hmm
So
hmm
awesome.
yep, yep.
And then I know you mentioned it a little bit before, but in terms of, I know you mentioned you wanted to be a coach to help people stay in academic medicine, not only get in, but stay. And I
hmm
guess for your own journey, was there ever a time when you felt like you didn't want to be in academic medicine, or was there ever a time when it might have been like harder and you kind of had to second guess it? And then if so, how did you make your way through that process?
Yeah, well, I think what's a little bit interesting for me is that since I didn't start in academic medicine, or I guess I should say, once I finished kind of my fellowship and my training, I left to do private practice to kind of, go out in the world and practice college health. So I came back to it, and I came back to it again with a lot of deliberacy and intentionality. Also knowing what I wanted to do in academic medicine, what I wanted to achieve. I will say that feedback I got very early on was that I was very good at setting boundaries. And I think perhaps that made a big difference for me because I'm not somebody who suffered from burnout. It doesn't mean sometimes I don't feel like I'm working harder than I need to, but I have not had burnout from medicine. And I think part of that is because of my setting boundaries, saying no. I was never someone who felt like anytime somebody asked me to do something, I had to say yes. Never felt that. Because for me, this is a way that coaching has been really helpful, is I figured out what my priorities were. And my number one priority was always my family and my kids. So if there was a conflict between two things and I had to choose between a 5 o'clock meeting or going home to be with my kids, I knew, well, if my kids are really important, then I won't go to this 5 o'clock meeting and I'll go home. So, okay, that's it. Then I'm going home. So it's just feedback that I heard, and something that I continue to do to the best of my abilities today. I think sometimes it gets a little harder as one gets higher up the ladder and the responsibilities increase, but I still am very intentional with my time and set boundaries and say no when I can. One of the things we talk about in coaching is if you say yes to something, it means you're saying no to something else. So if I agree to do something for somebody, what does that mean I cannot do anymore? And is that okay with me or not? And if it's not okay, then it means I'm not going to do that thing.
Yeah, that's a really great point. Like, if you say yes, you're also saying no. So yeah, I think that is a great point. Something that like even as medical students, we need to kind of remind ourselves for everything that we say yes to in terms of orgs, in terms of research projects, whatever it is, we're saying no to something else, even if it's like for ourselves. So
Yep.
yeah, I think like it sounds like, being able to like say have those boundaries and kind of really set you up for success like throughout your
Mhm,
career. So
Yeah. Yeah. And I think one thing that is another really important message that I like to just talk about with anybody, and this is medicine, this is academic medicine. It doesn't really matter where you are, but wherever you are in your career, many of us feel like we have to do everything, like, and we have to be good at everything. And I think it's a really important message to think you can do everything, but you can't do it all at the same time. And there's a time and a season for everything. And just because you can't dedicate 100% to your career right now, doesn't mean you can't do it later. So I think that's just an important message. Like, it's okay to say no to things. And it's okay to think, all right, I will delay this a little bit more because I'll have the opportunity later.
Yeah, I think that's a great point too. Just because you're saying no now doesn't mean it's a no forever. It could
Mhm,
be like a no, not right now, because I have to pull back and pour into something else. So
mhm,
remembering that it's like a length of time. So yeah, I think that's a
mhm.
great point. Something that it's easy for us to forget because we always are focused on the here and now and
Yeah.
not really what like the next steps might be that you might be able to do something later on. So
Mhm,
yeah,
mhm,
thank you for that.
mhm.
And then I guess for you looking back, is there any thing from your time as a medical student or a resident that you felt was really pivotal for your career?
Well, let's see, a few things. First would be in terms of my career was meeting a resident who did med peds, who did this thing that I hadn't heard of until I met this resident who was in this combined program. And he was instrumental. And when I saw him and how he was and what he knew and how he managed things, that was when I was like, that's what I want to be when I grow up. So that was hugely impactful, just in terms of my career and my trajectory. But I would say, even now, the relationships that I built in medical school, I still have them. And they're so important, and they're still important, decades later. And yes, we have reunions, but we have a smaller group that we have reunions with. So I was in the Latino Medical Students Association in school, and where I went to school, LMSA and SNMA were like this. We did things together all the time. So we still, as groups, we still have this little posse of LMSA and SNMA that sort of gets together throughout time. And that's just been so incredibly supportive, where we've been able to cheer each other on and follow each other's careers and trajectories. And that has been very invigorating, and gives me a lot of energy and a lot of strength knowing that we as a group still have each other.
Oh, that's so nice to hear that you guys like are still close and Hibbity wants to keep it like throughout time. So
Mhm.
that's really like nice. And I think also it kind of reminds us, we always think about like your classmates or like your future colleagues, but they could also be like your support system, like not only
Mhm.
in medical school, but like for decades to come. So yeah.
Mhm. Yeah. Mhm.
Yeah. And then I guess what is something that you perceive to be some great barriers to trainees in having a successful career in academic medicine, either from your own personal experience or maybe even from
Yeah.
people that you've coached through it?
Yeah. So I think one of the barriers is, there's probably a few barriers. One is probably the perceived workload, right? I think that there's this sense that it is so hard and so much work, and that it's too much to do all of that to be in academic medicine. So I think that's one barrier. And for somebody who really wants to do it, it's not going to be a barrier because they're going to love doing it. But for somebody who doesn't enjoy academic medicine, I wouldn't encourage them to be in academic medicine, because we have to enjoy what we're doing. It's so important for somebody to find what it is that speaks to them, their own kind of mission and vision and what they want to do in medicine. So, but I think there's this sense of, oh my gosh, it's so big, it's so overwhelming, it's too many things to do. So I think that's one barrier. And unfortunately, I think another potential barrier is the finances. I think that some people really focus on, oh, if I go out and work in private practice, I'm going to make a lot more money. And it's sort of, the other side of that coin of, yes, but if you like academic medicine more and you decide to do this other thing for the money, and it doesn't bring you the joy and satisfaction, then that's not going to be a good sacrifice. Just like we said before, if you're saying yes to something, what are you saying no to, right? So what comes out of your life? Um, and I guess the third thing is probably the lack of good mentors, right? That of people who really can say, "Come follow me. This is the path. Let me show you the path, and you'll see it's not so bad. And I'm there to support you, and I want you to succeed, and I want to help you." Those are probably the top three that I can think of.
Okay. Yeah, yeah, definitely. I feel like mentorship is one I could have like thought of, but yeah, I didn't even really think about the other two, and that's very true. I think a lot of times we think about private practice practice and like how much you could lose, but also if it's not giving you the same amount of joy, then it's not really worth it. And you could always like switch over. So it doesn't have to be something
Exactly.
that you kind of like keep over, as you are an example of.
Mhm,
You
mhm.
don't have
That's
to
right.
say one way or the other, but if it's something that
Mhm,
like you enjoy, then
mhm,
it's definitely
mhm,
something you should continue doing.
mhm. That's right.
And I guess in terms of I guess kind of going to the mentorship part, like do you think it was hard for you to find mentors to kind of see the way to go in terms of like how to build your career? Or
So not in the early years, not when I first came, because really the person who was here in this role before me, she was really a mentor to me, an excellent mentor to me very early on. And she was a mentor and a sponsor, right? She helped to create a job for me here when I was looking for more work. And she certainly promoted me into the position of Associate Dean of Curriculum Integration. She was a fantastic mentor to me. So I think it was more the higher levels where there are fewer women, where it's a little harder to to get that. And as we all know, this is how it is for women, but for individuals of color it's even worse, right? There are even fewer of those to sort of show the example of, look what I did, come follow me, right? That path is much less clear. So I would say in the early years it wasn't hard to find a mentor that was a little bit, a few steps above me. But at this point it is trickier because there are fewer people at that next level up that could really show me in a way, kind of do that. Oh, I was how you were before, follow me. And at this point, um, there are more men in those higher level roles. And I think one of the challenges is sometimes they don't have the same um, expectations in terms of family responsibilities that women have. So I think it's sometimes easier for men to stay late, to do the extra work, because there is, not for all, but for the majority, there is somebody else to take care of the children. And that makes it a little trickier.
yes, that is definitely true. I think being a mother through it all probably makes it even harder.
Hmm.
Um, so I guess along those lines, in terms of, being a mother and kind of balancing like building your career while being a mother, how was that balance and dynamic like for you?
Hmm. Yeah. Yeah. So in the beginning, I worked part-time, which was deliberate because I wanted to work part-time and I wanted to be home more with my kids when they were small. As they got older, I started to work more. As they were in school, then I gradually started to work more. And a few years ago became full-time. My oldest is now in college. My younger is a senior in high school. So they certainly don't need mom as much anymore. So it does free me up. So that was my trajectory. Not all women make that choice to start working part-time when the kids are small, but some do. So it's really, I think this is a great place sometimes for coaching conversations to help women, and any parent really. It doesn't have to be women. I mean, at this point, men could make this decision too if they wanted to stay home, really helping them think what's important to you and what is it that you want from your life, and what will bring you the most joy and satisfaction, of course within the context of the family and the family needs. And a discussion between partners is an important thing.
Yeah. Awesome. Yeah, I think that's a great point. And kind of going back to not only the need for coaching and like what your individual plan is or what your needs are, but like the fact that just because you do something now doesn't mean you have to do it forever. So you could do work part-time now and eventually continue working on building your career. You don't have to kind of go out the gate 100% full throttle with
Mhm.
academic medicine career, even though that's your goal. But you could kind of wait and do it at a time that works best for you and your family and take pauses and readjust as it sees fit with the needs of you and your family. So I think that's
Mhm.
like a great example for
Mhm.
people who think that they kind of have to do it all in the beginning, but you really don't have to. You kind of do it whenever works best for you.
Yeah, and I would say that is a place where I've coached a few women through that, where they feel this sense of urgency. If they don't get promoted by a certain age, it means that they're not good or they're not good enough. and that they really internalize those feelings, and trying to work with them and say, well, no, wait a minute, like, what are your priorities? What is it that's most important to you right now? Let's think, make a 5-year plan. Let's make a 10-year plan, talking about those kinds of things. So there isn't that pressure. One of the questions that I ask is, where is that pressure coming from? Is that an internal pressure? Is that an external pressure? Is there a self-esteem issue? Is there a need to prove something for some reason? Is that really beneficial to you? So these are all kinds of conversations that we have, so that people can also really figure out, this is important to me because of me, not important to me because I've taken in some external message, or because of whatever, my parents think, or because this is the expectation that society has. To really help people find their own individual voice, their own interests, their own needs. Even, is this the expectation of academic medicine? And does that serve me or not? That is a place where I've also, for myself, said, well, I don't care what academic medicine expects that I do. I'm going to do what's right for me and what brings me joy, not because some external force that tells me how I'm supposed to do things.
Yeah, I think that's a great point. Like recognizing, is it because it's what I want versus is because I just think this is what I need to do to fulfill a role that actually might not need to be fulfilled. You're just putting a burden on you that you don't even need to do. So yeah, those are like great questions to kind of make sure you're asking yourself. So
yes, they are.
yeah. Okay. And then I guess, what advice would you give to medical students who want to pursue a path in academic medicine and kind of work in medical education?
Yeah, well, so I think the first thing would be, find out wherever you are in your school, if there is a mentor for you, somebody who is walking the path that perhaps you can see yourself walking down. It might be on the education side, like where I am, with this focus in medical education. It could be on the student affairs side, right? That's another role in terms of supporting other medical students. It could be very focused on the departmental role, right? Somebody who's interested in neurosurgery and they want to do academic neurosurgery. Is there somebody in their home institution who could play a mentorship role for you? And I think sometimes students get a little bit nervous and they don't know how to do that. But all it takes is sending one email to one person and say, can I set up a meeting with you to talk about careers in your field? And nobody will say no. That is the thing. Nobody will say no. Send one email to one person and have that conversation. And in that conversation, ask the person, how did you get to where you are? How did you do this? What suggestions do you have for me? And everybody will be happy to have those conversations with the medical students. I think that's my first suggestion. And then once you find that person, maybe in another 6 months or so, send another email. Hey, can we meet again to talk about career stuff, so that you stay on their radar? And it doesn't have to be a big deal. It could be a half an hour meeting, doesn't have to be a lot. But try to find one person, and then it can go from there.
Yeah, and yeah, I think that's a great point. You just have to find one. I think we get overwhelmed thinking we need to find a bunch of different mentors and it has to be exactly what we want to do. But if you even find someone that's like along the same vein of like what type of career you want, whether it's student affairs or anything, that's at least is like a starting point that could kind of lead to different things. So
Yeah, and focusing on having a relationship with one person, you want that depth as opposed to the breadth, right? You don't want to have 5 people that you hardly know and they hardly know you. You'll get much more out of a relationship with one person who knows you and who you feel you can go to, and they know who you are, and you can have candid conversations with them. So that would be, I think, one suggestion, one step forward that I would suggest.
yeah. Awesome. And I like also said, like, just send the email and say, like, can we meet, just to talk about career. You don't have to have like a bunch of things already pre-planned. You could just say, like, can we just meet to touch base and get advice and tell you where I am? It could kind of really be that simple. It doesn't have to be as complex as I know I make it in my mind sometimes. I think I have to have like all these things I want to talk to them about versus just saying, I think a lot of times mentors probably know what we're looking for. Maybe even if we don't know what we're looking for.
That's right.
And maybe we could kind of like help in that way too.
Yep, absolutely.
Awesome. Great. And I think our last question will just be, what do you hope to leave as your legacy in academic medicine, both for your students and for your specialty?
So I think the, so first, that's a great question, but, and I would add, I, I am proud to say, and I think this is something we're not good at doing. We're not good at advocating for ourselves. But I will say what you said in your intro is one of the things that I'm already pretty proud of that we have been able to accomplish here at the school in terms of racism, bias, health inequities. You were involved in the TELP program and what we have been able to create and what the students have done as a result. As you know, we have had so many students present posters in various parts of this project that that to me is the best. The fact that we have created something and that students have been able to now get involved in academic medicine and get that feeling of what it means to do research within medical education and to promote their work at national meetings. I don't know how it gets any better than that piece of it for me. I'm certainly going to continue what I'm doing here at the institution and promoting quality medical education. We do have a vision of graduating exceptional self-directed physician leaders dedicated to the health and well-being of all people and all communities. And whatever I can do to facilitate that, I think is fantastic.
Yeah, awesome. Yeah, and I definitely say you, like you said, you're completely doing that. I am a testament to that. I was part of the TELP program, and I presented at the AAMC conference
Mhm.
this year, which was a great opportunity. It was great just being around so many people who are interested in medical education, and yeah, it was like great. So I definitely see your legacy kind of living out in front of you in that regards. Yeah,
Yep.
awesome. All right. Great.
Yep.
Well, thank you so much for being on our podcast. We really appreciate it. You share so many pearls of wisdom, so many things that I learned for the first time, especially things like coaching, which now is going to have my mind kind of twisting on what to do.
Yeah.
So thank you again. Is there any last words you kind of want to say or share before we end this interview?
Well, first, I want to thank you for your time. This was a great conversation and certainly want to encourage any medical student who's listening to think about a career in academic medicine, whether it be teaching or research. And I'm happy to be an initial resource for anybody if I can help point them in a direction that will lead them to the career that they want to pursue.
Sure. Awesome. Thank you so much. Well, thank you for everyone for joining this episode of Vitals Academia. Make sure you tune in for our next episode as well. And make sure you subscribe to this YouTube page as well. Thank you.
Thank you.